understanding the bone structure and the movement of teeth. Now I've got the skull that I got back over 50 years ago, and it is the real thing, in other words, and it's been worked on and everything, figured out all the sinuses and the blood flow of the teeth and the condyle, the fossa, and everything. So we'll be talking about it in the next 2 or 3 videos. What I'm going to try to mainly talk about is movement of teeth in the bone and understanding the kinds of bone structure that we have and to deal with. So anyway, here is a picture of a skull that's been cut down, and this is this is the mandible over here going back, and there's cortical bone, which is all of this that you see on the outside is cortical bone, and this is cancellous bone in here. And cancellous bone is kind of like honeycomb or something, and this shows the root and how much it's up into the skull up here, and your sinus frequently will come down and dip in around these teeth. Well, I'll take it back. It's going to come from the other side and just kind of come over the teeth. In other words, you can, when you open up the sinus, you will see the tips of the teeth protruding up lots of times. Now, and I'm having some sinus trouble right now myself, and I'm going in next month just a little bit and get something done to draining the sinus and reducing the turbinates, and so that's been on my mind. See, now there's an artery and a vein going to each tooth and a lymph vessel that drains the lymph off. Now when we go to move these teeth, then this has a lot to do. If you can look at this and see how thick the cortical bone is, and then look how porous the cancellous bone is. And I don't know of ever killing a tooth by moving it. And if you just move it over, I take this back. There was one lady worked in the office, and we got some rubber shells that were over, and she was trying to move a cuspid too fast, and it got to hurting, and she didn't pay any attention to it, and so the nerve died, and the blood supply to that tooth had problems, and you had to go in there and do a root canal and clean it all out to save it. Now, I've written some videos, or had some videos on group movement of teeth. Now, if you take several teeth in here and you want to move them back, I just hook on to the whole thing and move it, or group movement of teeth. And you can slide the whole thing and move it over to here, or you can extract a 6-year molar, say right here, and if you don't want these teeth to go back, you put a pin or a little screw into this cortical bone. Now, cancellous bone like this up here, you can put a screw in it a lot easier, but it works loose a lot easier. Now, when you put one in the cortical bone, it's really better to drill a little guide hole that's this smaller than the screw, so you can put the screw in here and have it coming up, just the head of it somewhere around in here, and you can bond that you can bond that screw to this tooth. You etch it and bond it to that. Then you can pull this whole segment of the teeth coming around from the other side. You can pull on them, but this part right here won't give or won't move, as that bone is down in that cortical bone. Now you're going to have another one on the other side, of course, and we can start pulling this wisdom tooth. This is a 12-year molar back, and we can move it all the way up here, and you won't be able to tell on the x-ray that it's not a 6-year molar. It can be a whatever, but it'll be right up against her just like it. And there's a way to move that where you move the teeth at the same time you move the bone. And you got a lot of that tooth in the cancellous bone, but then there's a good bit up here where you have this cortical bone around the tooth. And if you extract this tooth, let me erase some of that and you can see it better. If I extract this tooth and just say, well, I'll just eat with this gap in there, then this tooth right here will come over in it quite a bit, and a lot of times it'll be kind of angled like that. It just drifts over, and the teeth down here, as this goes over, it tends to push these teeth back because this cortical bone, the tooth is moving up here easier than down here. And so you'll pull it over here, and this will go back to some extent. Now, this is pushing cortical bone and moving it in that area. If this tooth right here, this 6-year molar, is missing, or someone extracts this 6-year molar for whatever, I mean, it could be rotted all out and everything else, but they say they take it out, then if you're going to close it with teeth, it's better to start immediately bringing this tooth and just drag this one with it and move both of them up to this area right in here. And you want their roots to go with them. So there's no point in pulling this over and then pulling this up. Then if you pull this forward up here, that make this go back some down on the bottom, not too much, but it'll go back some. So let's see how we need to do this. You need to start moving teeth into the space immediately, because you still have this layer of cortical bone out here and on the inside of the tooth. Now if you leave this tooth out for any length of time, then this part tends to go together here and over here, and you seem to have a knife edge ridge of bone structure between the gap. Now this will drift to some extent, and this will drift back a little bit, and it messes up the occlusion. So if you lose a tooth, it's far better to replace it, I mean, just as soon as you can. Now you can replace it with your regular teeth if you've got a wisdom tooth back here, but it would do away with this one's function up here. It would just be coming down in the so you might want to put an implant or something like that in this area if you've got good occlusion back here. But if you don't have anything to worry about up here, it's far better to fill that opening with a tooth, and we're going to pull it in like that. Now let me kind of illustrate how we do that. I'm going to just make a plain opening here, and we'll go back to that. But say these teeth were coming around like this, we're gonna take these molars back here, and we've got this little bicuspid up in this area, got it kind of nailed down with a screw in here, so this won't go back unless you want it to go back. Now we come in here with an arch wire like that. Let me draw this bigger so you can see this. We drop it down and come around like this, and now we come down at an angle like that. And so you've got this coming in like that, and this comes down here. So we raise this up and put it into the tubes or the bracket on the two teeth, and you tie this, run a tie wire through here, and then you bring that down where you put your wire in the place up here, and that puts a force going in this direction. Now you tie this back and you get it real tight, and these teeth will start to move, but these will stay there as you come around. And that force right here is a pretty good force. You raise it up, then it starts to move these teeth in this direction. And you're pulling up here, they move them in the other direction. And you watch that and judge this force you've got in here against the force that's coming down here that's pulling that down, and you can literally bring the teeth forward with their roots coming down normally, and these teeth will come forward like that, and you'll put the teeth right over in this area. Now if you've got this screw off to the side a little bit here, and you bond this area to this cortical, the tooth structure and the screws in the cortical bone. Now, then you can close this space and have the teeth sitting straight up just like they were to start with. Now, excuse me, that's no big deal, but that's something. Let's see if I can go back where we were. So you can do restorative work with teeth that you have in your mouth. A lot of times you'll have a wisdom tooth back here, or it can be impacted in here, like that, all kind of ways, and you can straighten up if the thing is laying down like this and the roots going back here. You can straighten that thing up and pull it up here, and you can pull these teeth right up against this, and you won't even see the difference. And if you took this patient to 10 other dentists, I imagine might be one recognize that. So as long as the teeth looked like normal size and everything like that. So this is a thing to learn about moving teeth in bone. Now if you leave the tooth out for a long time, then there'll be cortical bone over in here, and there is a whale of a lot of difference in this is cortical bone and this is cancellous bone right here, and there's a whale of a lot of difference in that. So when we are closing this, it has to cut through this cortical part in here, but it's not very much compared to what it goes. It's just only one side. You would keep this over here if you've got the little screw in there, and if you want to just have them meet together and bring this back some and this up some, and you make sure you come out with a class 2 a class 1 relationship there. You'll have the bottom molar out in front of the upper molars, something like that. So that is a good thing to know about teeth. Now, if you want to just move a whole group of teeth, you just have them lined up, and you got to have some force on the teeth, the angle kind of this way, and they're trying to push the root forward, and you're pulling the crown forward to get the teeth to come out parallel in here. So we're into bone structure and the movement of teeth in that bone. And it's certainly easier, and you can see for this structure here, you take a tooth through it. And by the way, as you move the tooth, you've got to really, I've had a lot of people get a tooth knocked loose or something like that, and it didn't break the artery or the vein going into the tooth. And so this is pretty soft in here, and this will allow the nerve structure and the blood supply to move around in the when you move the tooth. So this got the same thing up here happens if you want to pull this tooth. If you want to pull this tooth, and this is gone, then you would put that deal to here, and you go up and something like that, and then you push this way up, maybe even more than that. And as you pull this down, it tightens that spring, and if you left it alone, it'd tend to move these teeth up this way, but then you tie this back right here, just tie into the circle, and come back over here and tie it back real hard. And now you'll be trying to move the crowns forward with one of them and the roots forward with the other one. And I've been over trying to show people how you can move teeth around through the bone structure and just keep them, right straight up and down, if you want to. And if you pull more on the top, then they lean over this way. If you put more of the activation in this wire going down like that, then as you don't pull them up here, then you can put the roots and make the roots go ahead of the crown. But there's no point in doing any of it. Just keep them right in the angle that they're in. Now the teeth all have a kind of a incline like that, you see. So you don't want them straight up and down. You just have them inclined like that. Now I want to come back and do some more studies on bone structure and the sinuses and effect they have, and then have several other things like that that relate to the bone structure of the teeth. And this is a pretty good picture of those teeth like that. And one thing, we've got these fancy cameras now, and you can even blow that thing up, and you can take pictures and immediately you've got the picture there. We used to have to take them out of the camera and go back and get them sent off to get finished, and go back and get them and name them and everything. Well, now we just shoot it like that and put it up here. I just took these pictures just a few minutes ago, and we've got them here to study. And I'll be back now in a few days here, and we'll do another deal on this. And I think I'm thinking about trying to do the sinuses, since the roots of these teeth go right up in the sinus. And one of my sinuses is totally blocked out, so I've got to go into surgery on the 18th and get them to open that up and drain the sinus out, and I'll tell you about that later on. So I've got some first-hand stuff here to tell you about that. So thanks for watching this, and if you can, join the American Orthodontic Society, and for certain do orthodontics. Now, we are a group of pediatric dentists and general dentists, and we have some regular orthodontists that are joined too and work with us, and we're glad to have anybody in there, and it doesn't matter where you are in the world, we would like to have you as a member. So I'm going to close up now and say goodbye, and we'll finish this thing out. Thank you for watching now.